if we have a glass of water and we add sugar, a small amount of sugar, quantity of sugar can be diluted easily, okay? But when you put so much sugar inside of the glass of water, that produces a supersaturation of the water, and this sugar can be diluted, okay? That is similar to what's happening in the bladder, okay? And what's happening in the bladder? We have different events, mainly influenced by the pH, influenced by the inhibitor that the own urine have, the diet that eats the patient, and even the temperature of the body, even the temperature of the environment. What happens? When we see a supersaturated urine, can affect the solubility of the product. Mainly we see this table here. We speak about if the urine is stable. Stable means that the urine is totally diluted, and probably this is not physiologic, and most of the human beings and animals is in this state of urine, made stable. It's like equilibrium between inhibitor, promoters, pH, and this crystal can precipitate, but are diluted from mechanism of the own body, okay? And what happens when this metastable mechanism pass to be unstable? Unstable, that means that the supersaturation ratio is increased, and probably the urine can be diluted, okay? And in this state, inhibitor stop to work, and the crystallization can occur. And what's happened, the crystallization? Increase the number of solutes, and these solutes start to act, okay, and produce or form the presence of crystal in the urine. Finally, this crystal precipitate and produce the nucleation. It's like a nidus. And finally produce the crystallization is over and over and over, and produce the growth of the urolite and the aggregation of more and more crystal of the urolite. And this production of the urolite is important because calculi have a nidus, has another body of a body, and is conforming for a cell and conforming for crystal surface. This crystal can be the same, on this crystal can be the different type of crystal. What's happening in Europe according to the urolite? In this study, we have found I have changed the tendency of the urolite. You can see here in the round, there is significant difference mainly in the estrobite that decreased, but it's a little bit decreased, and purine have increased so much, okay, even 10 for 3%, and even the silica. What's happened with the silica mainly is in Sweden. You can find this type of urolite mainly for the volcanic water, okay, or for the mountain water is more common, this kind of urolite. But what happened in Netherlands? In Netherlands, you can see here the number of percentage of estrobite and oxalate is very similar, as well as the cysteine is still similar in the last years, okay, but the number of the cysteine is increased in comparison to the past. We'll talk about later. And UK, you can see here clearly that increased number of the estrobite, urolite, oxalate, and the third place is occupied for urate calculi. And curiously, in Germany, this study, if you see, the more common urolite is estrobite, followed by xanthine, I don't know the cause. They comment in the study that probably secondary for genetic predisposition or even importation of dog from Mediterranean country with leishmania. And the urate as the third type of the calculi, and oxalate is the fourth place, and that is very curious in German. Probably is the zone where the study was performed. When we do the diagnosis of one stone, we don't forget in a physical exam the rectal palpation. In the rectal palpation, don't forget to palpate the urethra, okay? Because sometimes you can touch the stone. To do a CBC, compared biochemistry profile, and urinalysis. All the time is recommended to do an urinary culture and sensitivity, because a bacteria could be the cause, but could be a consequence of the stone. So all the time is recommended to do an urine culture and sensitivity. And again, here the image is very important, like I mentioned it before. And when we do the X-ray, abdominal X-ray, minimum 2 view, or better if 3 of you, both lateral and one ventrodorsal. And try to include all the time in this case it's a female, that you can see here in the ureter, the urethra again, if you see any kind of urolite in the urethra, or in male dogs include the penis and the perineal urethra, because you can find here any kind of urolite. And you can move the high limb forward or backward, okay, to take the X-ray. And all the time when I do the abdominal ultrasound, I combine these two type of the imaging test. And the ultrasound, the echographies have to check all the penis and the perineal urethra as well. Okay? So remember, don't forget the penis and the urethra, the vagina and the urethra, perineal urethra. And another way we can confirm, or you can do the diagnosis, is with cystoscopy. But currently the imaging tests are enough to get a diagnosis. According to the when we do or when we have to do a culture on sensitivity of the culture, mainly when the urine culture have not performed, or when you suspected that you are in front of urolite but it's negative the urine, or when grow another kind of bacteria and that don't justify the presence of urolite. This is a very interesting consensus from the ACVIM, and you can discharge free. And it's a recommendation how you can manage of all kind of urolite in dogs and cats. How method we can use for removing urolite? We have all of these, okay? And could be spontaneous elimination, mainly that happen in female dogs, but contraindication when the stone is too large enough to obstruct the urethra, okay? And I recommend to the owner go to the sieve when the dog is peeing to take a sample, or try to recover the stone and go to analyze to obtain the diagnosis. There is medical dissolution, mainly cysteine and estrobite that I was talking about. There exists the urohydropropulsion, retrohydropropulsion that I want to see a video. And we can use basket or forceps during the cystoscopy or during the assisted cystostomy. Laser lithotripsy, where I am working right now, we have the laser lithotripsy for these cases. And when we do the lithotripsy, we have to be careful, mainly when you destroy the stone and there is small pieces of this stone. Some shape can tear the urethra, and these tears can produce stenosis. So it's very good option, I mean, for the treatment. But have some risk for the urethra of the dog, of the female dogs or male dogs. Lithotripsy, we cannot do it in male cats or in dogs that kilogram is less than 5 because the size and the cystoscopy is not going for the size of the urethra. In these cats or in small dog, we do the percutaneous cystotomy. That's I'm going to show you a video. This is a video about the urohydral propulsion. This is a patient of our service with Cushing, so it's complicated. Cushing is complicated to do a surgery right now. So option was to do the urohydral propulsion. The patient is sedated, is not anesthetized, okay? And you put the fluid inside with the catheter inside the bladder, and after you can put in vertical position and compress with stretch the bladder to spools of the calculi. If you see here, clearly you see a lot of calculi. What's happened? If the calculi have so much sap, can be again produce a damage in the urethra and produce an stenosis. So you have to advert to the owner when you are going to do this procedure. And this procedure, I just used to use it mainly in those that the surgery of dilution is not a good option for them. And after, when you do this urohydral propulsion, it's very important to check what's happened in the radiography. I mean, here this patient has another urolite here in the urethra. Here, after they put it inside the fluid, still has some urolite. This is another. We repeat again the urohydral propulsion, and finally, it's clean of the urolite with 2 procedures at the same time. Okay. This is the lateral cystotomy, assisted cystotomy, where you can see here, you have to do a very small incision over the skin and the muscle and the bladder, and you can go in with the channel work and the camera, and with the forceps of the basket, you will take all the urolite out from the bladder. Okay, it's a long procedure because you have to. You lost a lot of time trying to take out mainly the most number of urolite, because not the time you cannot eliminate everything, but you can try to do it. Okay. Okay. You see how the urolite is taken by this forceps. You went taking out from the channel wall, and right now it's outside of the dog. And this one is the lithotripsy. When you shooting with the laser all the urolite stone and start to destroy, okay, like this image. I mean, very cool. Have you seen? Yes, you can start to shoot it, okay, and start to decrease the size of the urolite. Even after the dog, these small pieces of the urolite can urinate without any problem. What could happen? Obstruction. Okay, so you have to advert to the owner that one of the complications of the lithotripsy could be an obstruction for a small site that could be attached in the urethra. And later there is the typical cystotomy, perianal uretrostomy, peripubic uretrostomy. And we're going to talk about the urolite. Steroid urolite that we know is produced by precipitation magnesium, ammonium phosphate, supersaturation in the urine, and the location of this kind of crystal and urolites mainly is the bladder and the urethra, but sometimes in the kidney. Okay, but it's not so common to find on the kidney. Okay, and we have to consider that one of major source of magnesium is the diet. Okay, so for that it's very important the diet that you give to the dog or cat with this kind of urolites. over the 90% is associated to UTI. So for that reason, it's very important to do the culture, the urine culture and sensitivity. Could be sterile in some dogs, but it's very uncommon, associated to the alkaline pH or genetic elimination of crystal. It's more common in female than male. Why do you think why this association exists? Yeah, good answer. It's for the UTI. You have to remember the longevity of the urethra in female dogs is short in comparison to, with male. And the breed that is more predisposed for this kind of urolite is Shih Tzu, Miniature Schnauzer, Dachshund, Pug, Bichon Maltese. Okay? And again, if you see the study, the frequency, I have not seen so much during the years, even in US and the Europe. Okay? And it's very common, up to 50%. And can present it in any age of the dog. It's associated with alkaline pH, could be associated to the diet, could be genetic, or when a dog presents a distal ventricular acidosis. This is a very weird disease, so it's not common. And the most common cause is infection or UTI secondary to Urolithiasis positive bacteria. These bacteria are Staphylococcus, Proteus, and Uroplasma, and can produce this enzyme, the urease, produce that the urea is split between ammonium and between bicarbonate, and bicarbonate increase the pH of the urine, and the ammonium is joined to the magnesium and the phosphorus, and this way produce the precipitation. Okay, it's lovely. And the urine analysis, we can find a pH over 6.5, even over 7. And in X-ray, the radiopacity can be different, depends on the type of the urolite and the patient. But it's typical to find a round, flat shape, like this one. If you see this female dog presented only this struvite uric stone, or could be multiple stone like this one, this pizza I remember call it Lola. And what is more important, struvite crystal have this coffin lid shape. Very important to know or consider that there is not a good correlation between the presence of crystal and the type urolite is it, okay? And could be and precipitation of struvite crystal only with the storage of the urine. When you send to the external lab, for example, in 4 hours can produce an scarce number of crystal, but you can see this kind of crystal and think, oh, maybe this dog present an UTI, but not. It's secondary for the delay they analyze the sample. Here in dogs, we can do the medical management. The serialization is around the 35 days mainly, and it's very important to eliminate the UTI. For that reason, it's recommended to check the urine with urine analysis at the 2 weeks after you start the treatment to try to see if there is still bacteria or disappear, or you can repeat in 2 weeks the urine culture as well, or wait and to do all the analysis and 1 month before to start the medication. Okay, and you have to combine with the diet. Okay, that is the importance of the diet to increase the struvite solubility, and this diet decrease the pH. This diet has the L-methionine that decrease the pH and present the low concentration of magnesium and phosphorus. Okay, and at the same time you have to check with imaging test the presence in the urine and the bladder of urolite every 2 to 4 weeks. Okay. Doesn't work. Yeah? So how many times we have to maintain the diet and the antibiotics? The recommendation is until 2 or 4 weeks that the urolyte totally disappear. And the size of number, the urolyte and pH at the beginning of the treatment not influence in the dissolution, okay? Could be a big stone, a small stone, and that is not a prognostic factor for the dissolution, okay? And what do you think? When you are diluting a stone, can produce obstruction? Yes, no? Okay, but if you think, I would, probably I think that it would be more common that really is. In this study, only the 18% of dogs presenting signs of the obstruction, so it's a low number of obstruction. So for this reason, it's very recommended to try the medical dilution before the surgery. When we have to do the surgery, when the medical management is contraindicated, obstruction of the dog present so much of severe clinical side for the owner, or occupied the entire bladder, on the UTI is not controlled, mainly because the owner is not compliant with the treatment. Okay, and one of recommendation is when you are treating with the antibiotic and the diet, and you repeat all tests, in 1 month later you start the treatment, you have to decrease the size from 20% to 100%, disappear totally, the urolyte. But if you see any kind of change or not totally disappear, you have to consider that probably it's not estrobite, or that's part of estrobite, of the capsule is composed by estrobite, but another kind of crystals. Okay? This is very important as well. That you have to treat the infection before the surgery, okay? Because when you do the cystostomy, there is a recurrence of the UTI because the infection can be or it can be in the suture and remain in the suture of the surgery, and that predispose for a recurrence of UTI, maybe for the long life of the dog. So very important before to do a cystostomy, treat the infection, and the infection should be negative before to surgery. And this is the urinary gamma that we have in advance that Alba commented before. Prevention, increase the water consumption. You can use water fountain, filtered water, like a Brita pitcher. I have one of these in my house for my dog and cat. And fresh water, change the water oftenly with low in minerals, and try to decrease the urinary specific gravity to dilute a more number of crystal, and use the preventative diet that commented before. Calcium oxalate urolytes, predisposing factor. We don't know so much about the causes, but we know that hypercalciuria may be associated with hypercalcemia. More of these patients present hypercalciuria, total hypercalciuria. And it's associated that hypercalciuria with the diet as well. On the other hand, we can find the hyperoxaluria. This is associated with vitamin C metabolism. In person or human being have been associated with thiamine deficiency, but that is not any proof in veterinary. Could be familiar, or in cat has been study that increased protein diet or protein with high levels of diet is not affecting right now the hyperoxaluria. Another instance that can predispose to this kind of urolyte is imbalance of the inhibitor, mainly the citrate, the magnesium and pyrophosphate, but there is another inhibitor like Tau-Horseman protein, nephrocalcin, uropontin, that has been proved that this is affected in dogs with oxalate calcium urolites. And the location mainly is kidney, ureters, and bladder, and urethra. And this article publication is very interesting because this study was making mainly in schnauzer, and schnauzer is one of the breeds predisposed to this kind of stone, and it was associated with hyperlipidemia, mainly hypertriglyceridemia. For that reason, when I see a schnauzer with calculi, all the time I measure the triglyceride and the cholesterol due to this study or this recent study. This is very interesting. Another predisposing factor are dry or acidic diet, but right now it's not a clear association between the pH and the production of this kind of stone. And the acidosis have to be so much can remove calcium from the bones to the systemic blood. And is more common in male than female, and is more common in mixed breeds, Schnauzer, Shih Tzu, Yorkshire Terrier, Chihuahua, and Bichon. And the prevalence is very similar to Estrovite and can present it at any age of the dog. Here in the urine analysis, you can find a normal neutral pH or low pH, and you can find this kind of crystal called monohydrate or dehydrate, that this is typical envelope shape that everybody knows. And it's very important measure as well the total calcium in this patient and the ionic calcium, because it's associated with hypercalcemia. Okay? And again, the storage can produce this deoxalate calcium crystal after 1 hour to be in the room temperature or in the fridge. And again, we have to do X-ray, and radio opacity is increased. Okay, and you can see the stone in the ultrasound, and you can do urolite analysis on urine culture and sensitivity, and urolite culture and sensitivity. The treatment, you cannot dilute this kind of stone, so probably you have to do lithotripsy, laparoscopy, cystostomy, or cystotomy. Okay? How we can reduce the risk of recurrence? It's better to use wet diet than dry diet to try to decrease the urinary specific gravity. And some diet we have to consider have more sodium salt mainly, and this salt can increase the loss of calcium in the urine, but dilute so much the urine that is compensatory in comparison that the elimination of calcium in the urine. Okay, and you can use a diet with high protein at the same time, because protein is not clear that is associated with calciuresis and acidosis, and all this diet present inhibitor like phosphate, citrate, and magnesium to try to avoid the precipitation of this kind of crystals. And these diets are moderate in calcium. And again, we have here all the gamma of urinary diets for dogs and cats. Medication. Mainly I use the diet and try to increase the consumption of water, but if you don't control totally the number of crystals, you can use medication like potassium citrate. This citrate increase the pH over the 7, okay, and you can have to control that apart or show another kind of crystal that can grow with alkaline urine. And when you use this medication, you have to monitor the potassium and the hydrochlorothiazide. And another that I have never used before is the hydrochlorothiazide. And this is stimulate the calcium reabsorption in distal tubules to this dose and twice daily. And another strategy that I commented before. And the relapse is high, okay? In the second year, 50% of cats relapse or recurrence of the stone, and the third year is over the 50% recurrence, this kind of urolites. The urolites, the main cause is the Dalmatian, is the genetic metabolic defect. This is a mutation present in the SLC2A9 that produce hyperuricosuria, high urine specific gravity, and acidic urine pH, and all of these predisposed to produce this kind of urolites. And what's happened? This receptor allow that uric acid go inside of the hepatocyte, but when you have the mutation, the uric acid cannot go inside of the hepatocyte, and this uric acid is less soluble in the urine. So start to precipitate and produce the urate stone. Another cause, the main cause, is the portosystemic shunt. You can see a patient of mine with urate. And the prevalence is the 30 and 35%, so it's very important to check this in patients with portosystemic shunt. And the bit more frequent you can find the portosystemic shunt are described in the square. What is more frequent in male and female can produce secondary UTI, and there can be, or you can find in all these patients, okay? But mainly Dalmatian, in the English Bulldog, American Bulldog, I think that's the most common breed that you can find. The prevalence is low in comparison to the beef urolite that's common before, and is presented in younger patients that in comparison the longer. Here, the pH can be low, or acid, or neutral, and you can find in the urinalysis this kind of crystal, okay, that's round shaped with a stick mainly, and the opacity, the X-rays can be totally radiolucent or have a little bit radiopacity, okay, and tend to be round and smooth like in this picture, okay. Sometimes you can have to do an X-ray with double contrast, but right now with the ultrasound machine that we have, it's not necessary to do that double contrast. You can try to do the dilution only if the patient has any kind of obstruction or no liver disease, and the dilution is 4 weeks. We have these diets, slow pouring diet in advance, and even you can try to give again potassium citrate if the pH not increased with the diet. More of this low pouring diet increase the pH of the urine. And another strategy you can try to use is allopurinol. In my experience, I try to all the time. I think I use the allopurinol, and when you are doing the dissolution, you use a higher dose in comparison to the maintenance dose of allopurinol. What's happened with the allopurinol? We have to control this animal not create shunting urolites. Okay, effectiveness in the Dalmatian is only the 40%, and you can see mainly in male Dalmatian than in female Dalmatian. Okay, and finally in the portosystemic shunt, they used to operate the shunt don't decrease the recurrence or relapse of this kind of urolites in the dogs. Okay, prevention: avoid recurrence during the diet low purine, preferably mix with wet diet with low purine. Increase the water consumption, and again you can use the potassium citrate or the allopurinol or use both. And check up, repeat monthly urinalysis the first 3 months, then every 3 to 6 months, ultrasound every 3 to 6 months, okay? To try to catch any kind of recurrence. Shunting urolithiasis. Here could be the cause genetic, mainly for deficiency for the enzyme shunting dehydrogenase, or be associated to the allopurinol. See you in Romania have cases of leishmaniasis? No? Okay, right now probably you are starting to see this kind of disease or no? No? It's not common. Okay. Yeah, here in Spain we have a lot of leishmaniasis. I have seen a lot of cases of leishmaniasis. And we use for the part of the treatment is the allopurinol. And what's happened with the allopurinol? The allopurinol inhibits or blocks the xanthine dehydrogenase that allow the transformation of xanthine to acid uric, and xanthine is insoluble in the urine again and start the precipitation and finally produce the stone. Can produce a secondary UTI. We don't know if more frequent in male or females, and again, is more frequent in Dalmatian, Cowley Salt Spanish, Manchester Terrier, Dachshund, and Cocker Spaniel. But the prevalence is very, very loud. If you don't are treating that with leishmaniasis, okay. What we're gonna see in the urine analysis, you can see again these yellow round form that are very similar to the urine. Sometimes it's difficult to differentiate between one of them to another of them. So for that reason, all the time I send to the external labs, and more of them are rather lucent and are like this picture, are smooth and round. Okay. And in this, the treatment, the option is remove the urolytes because the urolytes cannot be diluted, but the crystal can be diluted. I mean, when I treat a dog with leishmaniasis with allopurinol and sec to the mount and start the medication, I do ultrasound. If I see something crystal, I send the diet with a low purin diet and increase the consume of water. And you can dilute the crystal, but not the urolyte. Okay. And again, how to check up? You have to do the ultrasound, and 1 month they started the therapy, or when you did the surgery, and every 3 months you have to control the first year, and after you have to control twice a year. And we have finally the systemic urolithiasis. This one maybe is a problem in the proximal tubular reabsorption of the amino acids. Okay, mainly the problem is the reabsorption of this amino acid cysteine, ornithine, lysine, and arginine, and for that is called COLA. Okay, for the first letter of each amino acid, and this is a genetic mutation presented in the SLC3A1 and SLC7A9 gene mutation in dog. And before, just we're talking only the type 1 cystinuria and the non-type 1 cystinuria. This is a new proposal from a study that's 10 years ago, and the new classification is this one. There is a type 1, this is autosomal recessive type, the inherence, and type 2, this is dominant, and type 2B, and this is dominant as well, and affect some breeds, okay, you can find here. And finally, this is one of the old ways thinking about that one is the dependent of androgen, and this one is the type 3, okay? And it's described as well in some breeds, and these breeds is recommended the castration. Can produce secondary UTI, is more frequent in male than female, and curious, in US has increased this number of urolytes. Probably is fault of the breeder, okay? Because the breeder, when have one of the kind of mutation, they have to take out the male or the female to the breeding protocol. So probably for that reason has increased lately this number of urolytes. And the main breed affected is the English Bulldog, French Bulldog, Chihuahua, okay? And the Staffordshire Terrier and Pitbull. The prevalence is low, still is low, and present in adult individual. What we're gonna see in the urinalysis, this kind of crystal, this beautiful shape, hexagonal shape, okay, and the radiopacity can be totally radiolucent or can be mild radiopacity. And if we want to diagnose that there is so much amino acids in the urine, we have to do the urine cola test, okay? In what consists this test? This is a patient, one of my patients that present cystinuria, and one measure in the urine the cystine, the ornithine, and lysine. And this patient called Akito, okay? This is American Staffordshire from Valencia, and he are 4 years old, and you have the reference range. What do you think about this? It's increased the elimination of cystine, it's increased the elimination of lysine, and it's increased the elimination of arginine. So, he's losing a lot of amino acids in her urine, and for that reason is producing this kind of stone. So, how we can manage this sample? The sample is for spontaneous mixture, okay? Urination mixture, fresh, the first one in the morning. Even the patient come to the hospital, try to know pee before to come to the hospital, and give a glass, urinary glass, or I don't remember the name in English, for take the sample, and go out, take the sample and give it to him, and freeze immediately this sample and send to the lab and a flask with ice, okay? That is very important to manage the sample. This, we can do or manage this kind of urolite. We can try to dilute, okay? And again, with low purine diet, alkalinism diet, and restricted with sodium, okay? And the objective is achieve an urinary specific gravity low 1.20. That is very important because we need to achieve this objective because in this concentration or specific gravity is more easy for the crystal dilutes in the urine. Okay, so it's very important to control the urinary specificity in this patient. Eliminate secondary UTI if the patient presents an infection. You can again try to use potassium citrate in some patients when you cannot increase the pH only with the diet. And there is a more specific drug for the treatment, but the Thiola is very expensive. In Spain we don't have. You can find in Italy, but I remember I asked one time on the tablet with 10 pills. I remember it's over 1,200, something like that. It's very expensive. Okay. So I don't have experience with that, but with a good management of the diet and the water consumption, you can obtain good results. Remember, castration in the breast that you can be associated this cystinuria with androgens, and there is one study, or the study that questioned it is necessary to use taurine and carnitine, another amino acid that can be eliminated in the urine for this patient, but it's not clear. I'm not using right now this kind of medication. Finally, the prevention. Increase the water consumption, low purine diet, potassium citrate to increase the pH if diet is insufficient, and check up, repeat, urinalysis monthly the first 3 months, then every 3 to 6 months, and ultrasound every 3 to 6 months, because sadly these kind of urolites tend to relapse oftenly, okay? And I did, or the recommendation is repeat the cola every 3 to 6 months to see that decrease the number of amino acids in the urine, or the better option is the cysteine low to 200 milligrams per liter. And because when you use more restricted protein diet, can be insufficient amino acid supportive for the dog. But this doesn't happen with the advanced low purine diet. And this is Paquito again. I love the name. Yeah, yeah. Outside from the Spain, it's funny to say Paquito. And he's improved a lot. Have you seen the cysteine have decreased a lot with the diet, okay, and the water, and the lysine is as well improved a lot. And this one improved just a little bit, but it's better. And mainly the cysteine, the objective is less to 200, so we achieved the objective. And that's it. And thank you very much.